computer. Yes, I can. You guys, I got a lot going on right now. Great. So far, so good. I wish I could like turn my screen and show you my other screen where we're live on Facebook. It's great. There's like 7 people right now out here. It's fantastic. Yeah. Let's see how I can see this. All right, it's 9:30. Let's go ahead and get started. Good morning. My name is Courtney. I am the practice manager for Growing Bones Pediatric and Neuromuscular Orthopedic Institute. I'm happy to welcome you here today for our discussion on knee pain and the benefits of therapy. I am joined by Dr. Justin Connor, board certified pediatric orthopedic surgeon, and Michelle Flores, pediatric physical therapist. Welcome and good morning. Dr. Connor, I'm going to ask you to start us off with a little bit, tell us a little bit about knee pain, why your patients are presenting in your clinic. What are some of the causes and symptoms that you're seeing from your pediatric patients?
Sure. Well, thank you. I think that knee pain it's just one of those topics that is huge and it's broad, right? I mean, I think knee pain is one of the top reasons that any patient comes into an office, and it's whether it's pediatric or adult. Obviously, we're focusing on pediatric patients, and so knee pain really can have a wide variety of causes and even symptoms and the way that we treat it. And so it also depends on how old the child is, right? So children will describe their pain in different ways. Sometimes they'll say it's sharp or dull, or they're bending or popping, or even a very nondescript type of description based on how old they are, right? And so sports is a huge thing, especially down here in Dover and in Delaware in general. So there's lots of kids who are involved in sports, whether it's a single sport or multiple sports. Lots of kids who are doing running and non-organized sports as well. So I think that today we're talking about non-traumatic causes of knee pain, right? So obviously for those that there's an injury or there's some type of major events, those are treated completely differently. But I think the topic today is really about my child has knee pain and it came on on its own, didn't really do anything. It's been bugging me for either short term or long or longer, and sort of what could it be and what do we do about it? So I think just in terms of folks in the conversation, at least I think that's what I'd want to talk about today, because I think it's probably the most relevant to a lot of parents who want to know what to do when this is not specifically due to an injury. I would say that the majority of my patients are going to be sort of in that 10 or 11 to 15, 16 year old range. So they're going to be in that preteen to teen range. And a lot of them are very active, right? So a lot of them are in sports and athletics, and they're playing a single sport and they're year round. And they're getting knee pain and whether that knee pain is in the front or of the knee, which is sort of described as like the kneecap region, or whether it's sort of just in the knee, which is sort of on the inside and they can't really describe, and sometimes they'll complain of popping or clicking or making noise or instability or swelling or those types of things. And so that's, I think, probably the most common thing that I see in terms of a presentation. And so obviously that's sort of part of the exam, is to sort of figure out what's going on. And there's I just wanted to at least just touch on a couple things of what I see was pretty common. I know one of the the common things that people will talk about as sort of this bump on their knee. And you know, I'd say, so it's called Osgood-Schlatter disease. It's pretty common. And a lot of people are referred from their pediatrician for this. And so if you were to talk medically, you know, I think it's probably one of the more common things I see. It's the muscle in your thigh, your quadriceps muscle, that's responsible for extending your knee and making it straight. It basically will anchor into a part of your bone on the bump, which is a bump on your knee, and it's called the tibial tubercle. That's sort of the technical term, and it's that bump on your knee. And so sometimes that bump can get inflamed, and it can get irritated, and it can even grow in size and become sort of bigger than normal. And it's usually painful right in that area when you push over it. And a lot of times parents even know the diagnosis coming in, but you know, they want to know, well, what to do about it. And so you know, it's typically related to overuse, but it also has some associated, I guess, you know, findings and weaknesses that tend to go along with it as well. And I think this is when, you know, getting an assessment by a really qualified and trained physical therapist is very helpful. And especially when we're dealing with a pediatric population, you know, that's why, you know, with Michelle, who's here with us today, you know, she is part of that community that does these assessments in these pediatric patients, and really sort of focuses on it because it is often related to overuse and some associated deficits. So, you know, I don't necessarily want to talk about take up the whole conversation. You know, there's lots of different things we can talk about, and probably still will, I guess. But yeah, just sort of wanted to at least just start there, because I think that's probably what I hear a lot, you know, from my patients.
All right, thanks for sharing that with us. Michelle, kind of the same question to you. What are your patients most commonly presenting to you for, you know, and how does that initial evaluation and treatment plan get started?
Yeah. Thanks, Courtney. So typically when I get a referral from Dr. Connor with a knee pain or with like a specific diagnosis, that helps kind of give me an idea of like what to look for. So I'm looking for PT impairments. So I'm looking for how much pain does the patient have? How much am I finding any strength deficits? Am I finding any flexibility deficits? Am I finding any range of motion deficits? Any like muscle activation, motor control impairments, and all of that. And so based off of the examination findings that I find, that is how I start to make my own like exercise program. So I did make a basic exercise routine, which I think is helpful to just start with. A lot of them are just like exercise that you start on the table, on like, or in sitting, so that you can at least just try and work on strengthening the muscles and not so much of a weight bearing position. I find that like it helps to just try these exercises and see how they go, just to see how, and I would say these are pretty relatively safe. So at least in the basic program, I'm looking for helping to strengthen the quadriceps muscle, helping to strengthen the glute medius and the glute maximus muscle, so the muscles around the hip and the knee. And I also look at like hamstring flexibility as well. I also made like an advanced routine, which is more of weight bearing stuff. So stuff where your child is standing. So you're strengthening kind of the same muscles, but you're doing it more in a functional way where like your kid is like more active. They are like doing more of these standing exercises. So I have these exercises on the website, so you can look at those. And I will say that I made these exercises as like based off of kind of like the common findings that I see when I see like knee pain patients. But I would definitely recommend that if you're not seeing as much improvement, going to a physical therapist for an evaluation to see what exactly the impairments that you would that the physical therapist would like to address, because I'm just kind of making like assumptions on what kind of impairments you might see, but a physical therapist would be able to direct your plan of treatment much better than I would be able to.
Okay, yeah, thanks for sharing that. And for those of you who are following along and listening in with us, the exercises that Michelle is referring to, there is a basic program and an advanced program. Both of those links will be in the comments of the Facebook Live, as well as posted next to the actual transcript on our website. So do check that out. It is growing-bones.com. So refer back to those. I'm going to go ahead and start in on some frequently asked questions that we receive from some of our patients. Oh, Dr. Connor, did you want to go ahead?
Oh, sure. I just, hearing Michelle sort of talk about that, just made me think of, when I see pain as well. So I'm doctor focused, right? So I'm always about a diagnosis, and so I always come in sort of with a diagnosis, but really the diagnosis isn't why people have pain. And the majority of the time, I'm first determining whether things are surgical or non-surgical. And most things are going to be non-surgical, and they're going to be related to how people move and to functional deficits and to motor deficits. So for example, I talked about the one diagnosis earlier because I'm sort of diagnosis oriented and I'm thinking about one set of muscle groups, but then there's also other causes of knee pain. So one is sort of how the kneecap runs through the knee, and it's associated with a weakness of specific muscles in the quadriceps that are responsible for holding it in good alignment. And so, it's a different set of muscles than perhaps an Osgood slaughter. A tracking disorder is related to a different set of muscles. It's also related to alignment. So alignment of the hips to the knees to the ankles. And so, I think these assessments are really important. And, I think for me, that's where a lot of value lies, in having an assessment, because I can come with a diagnosis, right? And I can tell you where you're having inflammation, but especially if it's something that is not surgical, right? So, or at least not initially surgical. And I'm, of course, very conservative. I very much want to pursue non-operative measures first. I think your treatment really is it's made and lost based on the proper I guess the proper implementation of a good non-operative program. So
Okay, awesome. So I'm going to go ahead. The first question is going to be for Michelle, just referencing back to those exercise routines. How do I know if my child should perform the basic or advanced exercise routine?
Yeah, that's a great question. So I would recommend always starting with the basic routine, especially if your kid is having difficulty standing on their leg, or like has not tried moving their knee very much since like it started hurting. I just like being able to start them out on like a non-weight bearing position, just being able to see if they can like move their knee. Then once they start getting better at those exercises and they're like, oh, these exercises are just too easy, or they want to try something more challenging, or like the pain has gone down like since they've started doing those exercises, then I would start trying the advanced knee program.
And Dr. Connor, I'm going to let you answer this one first. Why should I choose a pediatric certified care team versus my regular primary doctors and therapists?
So to hear the question right, pediatric therapist, is that what you asked?
Yeah, so well, care team in general, you're a board certified pediatric surgeon, and Michelle is a pediatric therapist. Like, why is it important that we choose pediatric specific care team members outside of who we normally might see?
Sure. So, I think, despite how wonderful our children are, they're not small adults, right? So we sometimes see them that way, but they're not small adults, and they're growing, both developing both mentally and physically, and they're changing constantly in terms of their development. And there's certain disorders that are unique to children. So some of these knee pain disorders only happen in children because children are the only ones who have growth plates that are actively working and are actively growing. So, some of these diagnoses can't happen in adults. And so to be aware of that, to be aware of a common presentation, and to know what's typical for a child of a different age, right? So, something that may occur in a child who's 10 years old is normal, but may not be normal if it occurs in a 5-year-old, even though it presents very similar. But because of just the differences in where they are developmentally, having that as well. And I think probably the most functional reason for me is, like, kids want to have fun. Like, they want to go back to having fun, and they want to go back to doing what they're doing. You have to sort of have a team of not just doctors, but people who appreciate that and help them through that experience, because it's tough on them as well. So that's my perspective. It's not necessarily, strict medicine, but for me, I want to feel comfortable coming into an environment, especially with my child who's very uncomfortable, and make it as comprehensive, but also as pleasing for the family as well as the patient.
Right. Michelle, do you have anything to add to that, of why, I might want to choose a pediatric therapist?
Yeah, I mean, additionally, I think there's not as much as like, yes, like typically like pediatric care teams like are trained in like pediatric diagnoses, and they see those much more commonly. I would say also additionally, uh if a medical provider does like pursue like pediatric patients, and like like pursues a pediatric certification, they want to work with children, and they try to make it as fun as possible. So they typically like to use play to engage their children, and they typically, I find that they seem to like have a lot more results because they just genuinely want to work with kids.
Right. That is a perfect lead into my next question, which is how, leading back to your exercise routines, the basic and advanced, how do I encourage my child to perform those exercises consistently
Yeah.
without it
So
feeling like a chore?
yeah, no, I hear ya. I I love to use play as a way to make these exercises more fun. So on the exercise routines, I kind of brought out some ideas of like how to make it fun. So like when we're doing quad sets, like you're gonna squish a car underneath your knee, or if you are doing longer quads, you're gonna try and like hit each ball with your foot, and like you're gonna pretend like you're kicking, but you're just in sitting, and like, or you're doing step ups and you're doing it across an obstacle course. And it's just, I like to, like, instead of making it seem like, oh, like this is like an everyday thing that like is really boring, just finding ways to make it more fun, and like engage them with like the toys that they like, the movies, the music that they like, and just like remember like what your kid likes to enjoy.
Great. Thank you. Kind of a question either of you can answer first. Should I stop my child from moving or from exercising if it hurts?
So
Yeah.
yeah, I have to probably agree to, yes. I think
Okay, that was
there's a certain level of I think there's a certain level of just discomfort within norms for some exercises, right? So when I go to the gym, I push myself to a certain level, but I don't push myself to a level of pain. And similarly with stretching, I push myself to a certain level, when I'm stretching, but not to where I'm having pain. And so I think similarly with kids, we want them to participate and to be comfortable, and for the parents to be comfortable. And sometimes knowing that comfort level is something where it's helpful to have someone with some experience to say it's okay to feel some tightness, but it's not okay to feel pain, right? And so, but I don't think I would ever encourage anyone to push anything to the level of pain. And then, Michelle, if you have something different.
Yeah, I would agree. Like, I would not push someone to move to the point of pain or to more pain. Um, But as you start to see that like your child is is seeing like less and less pain, like I think that's when you can start to encourage like movement again. So even if it's literally just like the child doesn't want to walk as much, but like the pain is improving, just seeing if like, okay, how about we just try walking from the bed to the kitchen and just see how that goes. I do think like encouraging like movement, just like even if it's like minimally, just to like have them dip their toes in the water about how movement feels, kind of at least gives you an idea of like how much pain they have. And then gives that, and if it's successful, it gives them it gives the child like the idea that like, oh, like I can actually move a lot more than I thought I could. Yeah.
Okay, thank you both. This is going to be the last question, unless there are any others that can put in the chat box. But how long will my child need to perform these routines before we can expect, some improvement or resolve of the symptoms, or when we can stop? How long do we have to continue on these exercises? And that's Michelle, I'll shoot that over to you first.
Sure. I would recommend trying like the home exercises that I put out, or physical therapy sessions with concurrent home exercises for at least 4 weeks before you start noticing some improvements in your child's symptoms. It does take about 6 to 8 weeks of consistent strengthening for strength gains. So realistically, it does take time to see improvement. Um, and in terms of like when is it time to like stop physical therapy or like the home exercises, so the physical therapist would be in charge of the decision of whether to stop physical therapy. And so I think of this as like the discharge or like graduating from physical therapy. And when a physical therapist graduates a patient from physical therapy, the goal is that the patient or the child is independent with the home exercise program to prevent the recurrence. So your child will likely still have like home exercises after they're discharged from physical therapy, but that's an okay thing because it's helping them from keeping a recurrence from coming back.
Okay. Dr. Connor, do you have anything to add?
I think I'm in pretty good alignment with that as well. So usually on my end, after someone is in physical therapy, I will usually check on them in about a month. So that's sort of that 4-week time frame. Not that they're going to be completely healed, but that the program's coming along, that they're noticing some differences in how they're moving or how they're feeling. Also on the back end, which a patient doesn't see, but the therapist is sending me back objective measurements about where they saw them when they first started and sort of where they are now. And so there's not just how you feel subjectively, but there's also objective measurements of how you're moving, how strong you are. And so at about a month, I'll have a conversation with a patient, say, how do you feel it's going? And just let them tell me subjectively how they feel. And most of the time, they may or may not be there yet, but they can tell a difference and they can sort of know we're heading in the right direction, we're doing the right thing. And then I can sort of back that up and say, well, yeah, so we can actually see your strength is actually improved by 35% compared to the last time, and you're noticing that. So, and then we'll, talk about it and we'll continue the plan. And then, similarly around that time if either there's not objective improvements or not subjective improvements, I usually will pick up the phone and have a conversation with a therapist, just directly, and we'll sort of talk about it, right? So, and say, yeah, so what are you noticing? And they'll tell me what they're noticing, and we'll talk about the goals and the plan. And a piece of paper doesn't do justice to how people are doing in the real world, and so this is very much a team sport, and so that's the way that I look at it. And I think that, by the end of the program, everybody's on the same page, right? Everybody is saying, yep, we are where we need to be. It's time to transition this over. And I feel like I can take this on myself at this point.
Right. Well, that was our last question. So I'm going to turn it back to either of you if you have anything else you'd like to share before we wrap up. No. All right. Well, I want to thank both of you for being here and giving us all some insight onto knee pain and some benefits of pediatric physical therapy and home exercises. Thank you both so much for your time. Again, the links to the resources that we've discussed in this video will be on our website, growing-bones.com. Thank you so much.